The business of medicine is constantly changing. The review by Resolve discusses current contract issues for physicians, compensation trends, and tips for a successful career. Every physician's contract and career is different, and nothing in this episode should be considered legal advice. If you have specific questions about your career, please consult with an attorney. Now, on to the show.
Lauren Kaufman, welcome.
Thank you.
To the review. Do you want to start out and just tell us about yourself?
Sure, yep. Lauren Kaufman. I'm an attorney at Resolve Legal, and I've been practicing for over 10 years now and exclusively doing physician contracts for just about 4, I think.
Awesome.
Yeah.
Well, we're going to chat a little bit about letters of intent, term sheets, memorandums of understanding, kind of that first step
Yep.
in the physician process. What do you like best about letters of intent?
I like that it gets down to the brass tacks quick.
It is. Okay.
Yeah.
So for anybody watching this, letters of intent have what on them?
It's things, kind of the essentials of the deal.
Yeah.
So salary, other types of compensation, incentive bonus, sign-on bonus, relocation. And then those are kind of the number one type of things. And then there will be things, malpractice, benefits. Sometimes we'll get into schedule and restrictive covenant, but each one is, sometimes a letter of intent will be 1 page, sometimes it'll be 16 pages,
Yeah,
but
right.
it's usually on the shorter end.
Right. So when I'm talking to clients, sometimes they will be confused on what they're looking at, right? They don't know if it's a letter of intent. They don't know if it's actually the full contract.
Yes.
There's certain types of employers that I think are a little bit sneakier maybe about how they frame up the offer. In your experience, which types of employers utilize letters of intent the most?
Well, academic.
Yeah.
Academic versus non-academic is, I think, where that distinction comes most importantly. Because an academic institution will almost always use the letter of intent as their entire contract.
Right.
And when it's a MOU, memorandum of understanding, or a letter of intent, I think that people who maybe have had a different position can get not tricked necessarily, but they may sign thinking another contract is coming, but a lot of times it is not with an academic institution.
I think they might get tricked.
I was
right?
going to say, sometimes it's clear, sometimes it isn't.
Yeah, I have a lot of clients that come in and they're very confused, right? Where they're saying,
Yes.
I just got this letter of intent from so-and-so, and then, when we take a look at it, we're like, that actually at the bottom says, I accept this offer, right? It's kind of that legally binding language that we don't like as attorneys. In the interview process, they made it seem like there's going to be something else that comes along after, and there's really not with academics. And so I completely agree with you on that. Do you see many letters of intent from private practice, like a true private practice?
Almost never.
Yeah.
Yeah, pretty rare. I think some of the bigger hospital health systems utilize those. I think the difficulty for us is that sometimes we get clients after they've signed the letter of intent, but they still want to negotiate those terms. And I think that...
How's that go?
I don't recommend.
Okay.
I think the difficulty is they get told from the employer, hey, it's a letter of intent, it's non-binding.
Right.
We've just got to get you to sign it to get the contract started, and we can talk about it.
Right.
And then, so they're like, yes, fine, we'll sign it. And then they're like, but I wanted to discuss the salary.
Sure.
And it's like, well, you have signed this, and there is an intent to move forward with those terms. And so it can set you off on the wrong foot with the employer when you're then trying to negotiate the salary after you've, or any other terms in there when you get to the contract stage.
Right. So I think the clients are confused on,
Yes.
this is just me accepting the idea of getting to a contract versus
Right.
this is me accepting the exact terms, right?
Exactly.
And I think the struggle that I have with clients is that they don't understand necessarily that even if it's legally not binding, right? So it is just an offer letter and it says maybe it's non-binding in the contract or in the document, that it's really hard to get the physician recruiter or the CEO of the hospital or whoever you're talking to say, I signed off on $60 per work hour review and now I want 70. And they're like, well, I thought we had a deal right on this already.
Exactly.
So when that happens, when clients come in and they do want to change it, how successful are they once they've signed a letter of intent to renegotiate?
I would say
your gut. I know that you don't have
I think I mean, just comparatively, much less successful than someone who negotiates at the offer letter stage. I'm not saying it doesn't happen, of course, and we're always going to still try to negotiate it and say, hey, they signed without the benefit of having spoken with us, compensation data review, so we want to take that under consideration. But I do think you're starting out behind in that case because they're going to say, but hey, I thought we already agreed, and where is this coming from? And so if you're negotiating at the offer letter stage, I think you're much more likely to get an increase in comp, signing, other types of incentive than you are if you've already signed the letter and are trying to do it at the contract level.
Yeah, I agree. I mean, even as an employer, right? Like all the people that work with Resolve, if somebody came into me and said, yeah, I signed the letter of intent and then they want to renegotiate later, I'm not saying I wouldn't, but it would be very frustrating for me. So I do have a little bit of empathy on the employer side of like, I thought we had a deal. So our preference is definitely come in early. If you want to negotiate, do it early on and not later on. How many of your clients do you think have signed multiple letters of intent?
25%.
25%. Okay, that's higher than I thought. Okay, so what?
It's almost never on my advice.
I was going to say you're not telling them to do that.
Yeah.
How often? I guess one, are they surprised that they shouldn't be doing that, and then two, what's the next step from there if they've really, they've locked themselves in? Like, let's say one of those is with an academic institution, and so they've signed a full contract on one, and then just a non-binding letter of intent on the other. What's the procedure on that?
I mean, I think it's a little bit of a kind of brass tacks conversation with the client first, with the physician, and hey, what position do you want? You don't want this academic one. Well, you're going to burn. I mean, legally, there's probably a way for us to get out of it through a without cause termination notice period. There's a lot of factors involved there. So definitely do not recommend it. Maybe they can't get out of it and it's, they're just kind of got to move forward. But, I think that with an academic especially, they can be a little bit more hardened to that. I think maybe there's kind of two aspects there, right? There's the kind of legally, can you get out of it? Then there's the professionally, what have you done? And you've burned a bridge. And I think that those considerations sometimes they have to be taken into the thought process, but can't really be avoided if you're wanting. And I think that's the problem with signing several letters of intent is even though, and I think some physicians are like, well, hey, I've got the offers. I want to see how this progresses. But I think it honestly does provide a bit of an emotional, mental toll on them trying to juggle them at times too.
Yeah, I mean, termination is stressful, right? Whether you're in a position for 5 years or whether it's at the letter of intent stage that you're going to walk away from it. I do think that's tough.
Yeah. Mm-hmm.
So, okay, so our advice is don't sign a letter of intent until you're ready.
Yes, until you like what the details are.
You really like the details. You've looked at fair market value. You know what your compensation should be. You know what other terms you want to include on that. And then if you're comfortable,
you've talked to us first.
Talk to Lauren or me or somebody else on the team. And then if you are comfortable at that stage, go ahead and sign it. Get to the full contract. Work out the rest of the details.
Yes.
Okay. Awesome. Thanks for talking about letters of intent.